Telehealth isn't just a buzzword anymore. It's here to stay. And in the world of behavioral health, it might be one of the biggest opportunities we've ever had to increase access, reach underserved populations, and improve continuity of care. Hi, I'm Adam Gunton, founder and managing partner of Behavioral Health Partners. And today, we're diving into the role of telehealth in behavioral health services, why it matters, the benefits and challenges of using it, and some best practices to implement it effectively in your own treatment model. Whether you're running a rehab, managing a private practice, or you're just starting to build your center, this video will give you clarity and maybe even the push you need to move forward with telehealth confidently. Let's get into it. First off, let's address the obvious. COVID-19 changed everything. When the world shut down, the behavioral health field had two choices: go remote or shut the doors. Telehealth went from a convenience to a lifeline almost overnight. And what we learned is that it's not just a backup plan. It works. Clients showed up, counselors adapted, and in many cases, people found it easier to open up from the comfort of their homes than sitting face-to-face in a clinical setting. Now that we've seen its potential, we need to treat telehealth like the strategic opportunity it is, not just a temporary solution. So let's talk about the benefits of telehealth. Number one, expanded access. Telehealth allows you to reach people you never could before, especially in rural or underserved areas where behavioral health providers are scarce. Someone in a farming town 2 hours from the nearest city can now meet with a licensed therapist or addiction counselor from their living room. That's a game changer. And when someone is struggling with addiction, depression, anxiety, or trauma, the difference between getting help today and having to wait or drive hours could be life or death. Number two, increased client retention and attendance. Missed appointments drop significantly with telehealth. No more transportation issues, no calling out of work, and no last-minute childcare conflicts. And let's be real, for clients just starting recovery, making it to an in-person group at 9 a.m. can feel like climbing Everest. Telehealth removes that first barrier. Once they're more stable, you can transition them into more intensive or in-person programming. Number three, continuity of care across programs. With telehealth, you can maintain engagement with clients even after they discharge from higher levels of care. Imagine offering IOP remotely or follow-up therapy to alumni who moved away. Telehealth allows your program to support long-term recovery and continue building relationships that fuel referrals and word-of-mouth marketing. Number four, flexibility for your team. Let's not forget about clinicians. Telehealth can reduce burnout, give them work-from-home options, and help you recruit top talent from across state lines, as long as they're licensed where your clients are. All right, telehealth is great, but it's not without some challenges. So let me give you a few to be ready for. Number one, technology gaps. Not every client has strong Wi-Fi, a private room, or even a smartphone. And while some platforms have dial-in options, it's not always ideal for trauma-informed therapy or group work. You need to assess your client population and consider offering support, like tech tutorials or quiet spaces at your facility, if you want to overcome this hurdle. Number two, privacy concerns. Confidentiality matters, especially in behavioral health. Make sure you're using HIPAA-compliant platforms like Zoom for Healthcare, Doxy.me, VC, or Simple Practice. These platforms are designed for medical use and provide encrypted sessions, waiting rooms, and documentation options. Also, make sure your clients understand how to protect their own privacy, from using headphones to finding a private room where they feel safe. Number three, licensing and reimbursement. Rules vary from state to state. Some require providers to be licensed in the state where the client is located. Reimbursement rates for telehealth may differ between Medicaid, Medicare, and private insurance. That's why we always recommend consulting with a healthcare attorney or compliance expert before scaling your telehealth offerings. The last thing you want is to violate regulations you didn't even know existed. So, how do you implement telehealth effectively? Start with a clear clinical workflow. Don't just offer telehealth as an option. Build it into your programming. Which groups will be offered online? What about intakes, family therapy, or medication management? Then train your team. Even the best therapists need support learning to manage a room full of clients on a screen, navigate lags, and maintain therapeutic connection without physical presence. And make sure your marketing and intake teams are aligned. Let your prospective clients know you offer telehealth. Put it on your website, on your service pages, and in your intake calls. If you don't promote it, it doesn't exist to the people who need it most. At Behavioral Health Partners, we work with addiction treatment and behavioral health centers to build and market telehealth programs that are both compliant and competitive. So, if you're considering adding or expanding telehealth, don't just wing it. Treat it like a strategic business move and an extension of your clinical mission. Before we wrap up, here's one more thing. If you're in the early stages of opening a rehab or building out your services, make sure to watch our full breakdown in the video How to Open a Rehab Center, or visit the guide linked in the description below. It walks you through licensing, pro formas, marketing, and more, all from real experience. And if you want support building or marketing your telehealth program, apply to work with behavioral health partners using the link in the description. We're proud to be one of the only agencies in the country that combines real recovery stories, clinical insight, and proven marketing strategies to help treatment providers grow. Thanks for watching, and I'll see you in the next video from Behavioral Health Partners, your partners in growth and impact.